My name is Sean Neighbors. I am the Clinical Director of the Anxiety Treatment Center of West Michigan. We have been in West Michigan for about a year now, happy year anniversary to us. I am a therapist who specializes primarily in treating anxiety disorders. Now, I do see other issues, but primarily at the Anxiety Treatment Center, we primarily see anxiety issues. So, how many of you are school counselors? Okay, so everyone's a school counselor? Okay. So, the overview of today, we want to talk about the stigma of anxiety in general. We're going to talk about anxiety education, the purpose of anxiety, common childhood and adolescent anxiety disorders, what anxiety looks like in children and adolescents, a systems approach to addressing anxiety at school, therapeutic treatment for children, and adolescent anxiety. So that'll be the overview of what we're going to cover today. So when you do a Google search of common Western values such as power, dominance, confidence, these are some of the pictures that come up. So these are what we value in our Western society. We value being powerful, we value winning, we value our children being strong and overcoming and being dominant and handling their environments. And we ourselves, we value being confident within ourselves and our environment. So to reiterate some of these values in Western mainstream culture are power, confidence, authority, leadership, dominance, a sense of better than the next, individually achievement-oriented, and perceptions of people in Western society who outwardly exhibit anxiety. We view these people as inferior, weak, pushovers, less than intelligent, followers, less credible, and prone to mistakes. Now, we're not purposely trying to make these, assumptions or impressions of people who show anxiety, but it's the natural tendency we get when we notice people who are anxious. We get natural tendencies to think these things, either on a conscious or subconscious level. And that is a direct result of the culture we live in, the media that we take in, the societal norms we have. That's a result of that, the cultural context that we live in. So what does this mean? This means that outwardly showing anxiety in Western society goes against the cultural norms. What if I were to freak out right now? You guys would have some of these about me, right? So ultimately, this affects the treatment approach within anxiety. These cultural norms affect the treatment approach. So there are primarily two camps of treatment approaches that I identify with anxiety treatment. One is that anxiety is adaptive and it's positive. The other is anxiety is a negative nuisance. So based on your orientation, the treatment for anxiety will be different. So the adaptive positive camp looks at anxiety in the sense of how can we get you to appreciate anxiety and develop a better relationship with it. The nuisance says how can we get rid of it? How can we medicate it away? What tricks and tips can we use so that you don't have to feel this anymore? So based on the orientation of how you feel about anxiety from a cultural standpoint will determine the treatment approach. So what is anxiety? We'll talk about fear first. Fear is a fight or flight response to a threat that is real in time and space. So fear is something that's right here, right now. You can see it, you can smell it, you can observe it, and you pretty much are sure it's going to cause you some sort of bodily harm. Anxiety is a fight or flight response to a potential threat that cannot be located in time or space. So this is a concern that something's going to happen. You can't actually locate this threat. So therefore you are anxious about it. So anxiety is the forecasting or anticipating of potential danger. So why do we have anxiety? For those of you in the back, I'm not sure if you can see, but this guy here is brandishing a knife behind his back as a gentleman and what looks to be his girlfriend are walking past him. The survival of individuals in our society depends on their ability to predict danger and then mount a defensive response if that danger were to happen. So if you look at this, just trying to see if I had a laser pointer here. If you look at the gentleman, he looks concerned. He looks anxious. He can't be afraid at the moment because he can't see the knife. But there's something about that guy that's making him anxious. So he's holding his girlfriend a little bit tighter. If you notice, I'm sure he saw that guy coming down the sidewalk. Maybe if he was on the other side, he probably switched sides. There's something about this guy that's making him predict that danger may happen. And he's getting pretty anxious about that. So our survival depends on our ability to worry about danger, obsess about danger, develop a phobia of danger, imagine danger, and predict that danger will occur. Now, some of these words in here are associated with anxiety disorders, but yet our survival depends on it. So let's talk about worry. What's worry normally associated with in terms of an anxiety diagnosis? Any guesses? I heard it. GAD? Yep. Generalized anxiety disorder is pretty much comprised of constant what if thinking, chronic worry thinking. What if this were happen? What if that were happen? So it's a disorder, but we need that worry. We need to worry about our environment, because if we don't worry about our environment, we'll become complacent, and something dangerous may happen that we probably should have worried about. The next one, obsess. Anyone want to guess what anxiety disorder comprises obsessions?
OCD.
Yep, OCD. So we need to obsess about danger. Each and every single one of you have obsessed about danger today. None of you have haphazardly walked out to your car, got in the car, haphazardly drove on the highway, came here and haphazardly walked through the parking lot. You were obsessing about danger the whole time. That's why you drove the speed limit. That's why you checked your mirrors when you lane changed. That's why you just didn't run through the parking lot or carelessly step out behind a blind corner. You're obsessing about danger because you want to make sure that you're safe. And you're doing that subconsciously. The next one, phobia. So specific phobia. We need to develop a phobia of danger. We need to be afraid of danger, because danger has the ability to reduce our life expectancy. So we need to be afraid of that. So anxiety is a proactive action that is committed to the prediction and avoidance of threatening situations. Fear is a responsive action that is committed to running, fighting, or becoming neutral to an unavoidable, life-threatening situation. So why do we have fear and anxiety? Focusing on the alarm system of fear and anxiety, we're going to break these components down just to put them all together now. So anxiety is concerned with worry, obsessing, predicting, and avoiding. Fear is concerned with running, fighting, freezing. That's it. So how many of you separate fear and anxiety? When you think about fear and anxiety, they're separate. They're two separate things. Anyone think that way? Okay. How many of you put them together? Okay. So in society, these two things are commonly put together, fear and anxiety. I'm afraid or I'm anxious. They use them interchangeably. So all we're doing here is we're just separating the two and highlighting the features within the two. So our ancestors used fear and anxiety to get us to the point where we're at now. So for the threat of a predator we use the fight or flight or the neutral response. So if there was no option to run, we would fight it. If there was no option to run and it was just too big and bad to fight, we would faint and play dead. Or if there was an option to run to safety, we'd run and we get there. Now over here, you all may not be able to see this, but this is a picture of a very dark forest. So venturing outside of the safety of the campfire out into the unknown would create anxiety because we don't know what's out there. So we need to predict, is there anything out there that can harm me? What do I hear? What do I smell? What do I sense? Is there anything that may harm me? And if not, then I may go out there. I still may not. So anxiety is adaptive, and it keeps us alive. So that's the way I view anxiety. At the Anxiety Treatment Center, that's the way we view anxiety. When we say develop a healthier relationship with it, we highlight how positive it is first, so people can begin to understand and have an appreciation for it. So things like security systems, pepper spray, the TSA, these big body scanning machines, self-defense, these things are all components of being anxious, of being afraid, of worrying, of predicting danger. So because we are worried about our safety, we mount a defense response. Our defense response is to get that security system because we've predicted the possibility of danger happening, to have pepper spray on us, to protect our airports, and to protect ourselves personally with weapons in case we should ever need to defend ourselves. So the anxiety, what I tell clients is the anxiety is what mounts our defensive responses. And our defensive responses are what keeps us safe most of the time. So it's just kind of putting a little bit of a different spin on anxiety. So when people say they hate anxiety, I say, well, would you want to go to an airport and then there was just a straight line to the airplane? There's no security screen. People just walked on the plane. I know I wouldn't. I probably wouldn't get on the plane if there weren't a security check. So the anxiety of the nation says that, hey, something dangerous may happen. We need to have a security check here. And I can really appreciate that. So I like getting on the plane knowing that, people have been screened as best as possible. So we also look at anxiety as not being problematic at the Anxiety Treatment Center. We don't think anxiety is the problem. So I want to get rid of my anxiety. I don't like my anxiety. We take the spin off of I don't like my anxiety and anxiety is a problem to the problem is more so our lack of understanding of how anxiety works and why we have it. So we don't have our user's manual. We're not born with manuals for our bodies. That would be amazing if we were. But we're not born with manuals of how our bodies work. And the problem is we don't understand the manual, or we don't have access to it to begin with, let alone to understand it. So another problem, besides anxiety, is our negatively oriented relationship with anxiety in this society. So what that means is that any time anxiety is felt, to some degree, we're unwilling to be okay with feeling it. Whether it's a distressing amount of anxiety and you have a high amount of disdain and not wanting to feel that, or if you feel that you don't want to have it at a low level. To some degree, we all don't want to have it. A lot of us aren't willing to say, I'm anxious and I'm okay with that just as well as, I'm hungry. So we can tolerate being hungry very well, but we can't tolerate even a mild form of anxiety. And if we can tolerate it, we still don't want it to be there. So how fear and anxiety work in the brain? Got to back up. Forgot to do my question. So, on a scale of 0 to 10, in panic, 0 being not close to panic, 10 being panic, and we rate all anxiety on the scale of panic because panic is the end manifestation of anxiety. How anxious would you all say I am right now as presenting? Let's have some guesses. Feel free, don't. 4? Was anyone here for the last presentation? Okay.
Wait, so you said 10 was panic? Or what?
10 would be panic. 9 would be on the door to panic. Pretty close.
I say 2.
A 2?
2.
7.
Instead of 6? A 7? A 2? Okay. That was right. That's why I asked for you here last section. But a 6 is right. Yeah, so 6 is right. I'm at about a 6 right now. So clinically significant anxiety starts at 7, which means that when your anxiety is at a 7, it means that your thinking is now impaired. You're not thinking as rationally as you could be because you're experiencing an overwhelming amount of physical sensations. So what I'm experiencing right now, so I'm using myself as a specimen, what I'm experiencing right now is anticipatory anxiety. I'm anticipating giving a speech, and therefore my body has become aroused because of that. There's nothing I can do about anticipatory anxiety. We all experience it to certain degrees, but we cannot get rid of it. It's impossible to get rid of anticipatory anxiety, and you wouldn't want to get rid of it. If you got rid of it, your life expectancy would drop, unfortunately. So we need it. It's an essential component of us as human beings. So what we need to do is we need to learn how to tolerate it. The better you can tolerate it, the less it bothers you. So sometimes when I'm doing therapy, I've been at an 8 or a 9 with the client. I'm actually more anxious than the client is that I'm doing therapy with. You know, how does that work? So, but the only reason it works is because I'm willing to accept it. I don't over-pathologize it. I don't look into it too much. I don't internalize my anxiety as being one of those negative things about myself. It just is, and it's there, and I love it because 2 nights ago I was walking out of my office and I heard behind me footsteps really fast. So I automatically startled up. I pulled my bag close to me. I moved over and I clenched my fist in case I needed to react. Because it was coming fast. I don't know what it was. It sounded like someone was coming directly for me. That's how fast it was coming. And I looked back, and it's a kid jogging. I mean, he's hauling. He was probably the last part of his run. You know, he was trying to finish hard and sprint out the run. But I'm glad I had that startled response because had it been danger, I would have been ready to take him out. I may not have succeeded how I wanted to, but I would have been ready. And that's the important part. Now, if I were not anxious, if I did not have my anxiety, and that person was running behind me, I would have been thinking, oh, I'm going to go home, I'm going to throw a pizza in the oven, as the footsteps are actually coming up behind me, I'm thinking about what I'm going to do when I get home, and I'm not ready to have a defense response. The next thing I know, I'm laying on the ground and I'm wondering what happened. So my anxiety prepares me for what may happen, and that's why I love it, because it's like who can you say is constantly looking out for your safety all the time? So we give anxiety this type of personality. It becomes this person that has your best interests. So we really start to form, we make it hard for people to really start, hating their anxiety when we highlight how helpful it is for you. So how it works in the brain, primarily the amygdala, thalamus, and the hippocampus are involved in the anxiety response. It is an automated response. It happens beyond our control. We cannot control our anxiety. If I said there's a bear in this room, there's a bear in this room, there's a bear in this room, I wouldn't get anxious until there's a bear in this room. So it's an automated response. It works on its own. So this little yellow part of the brain is the amygdala. The amygdala is our emotion center. The amygdala is directly connected via the nervous system to our senses. So your senses go directly to your amygdala first, before they get to your prefrontal cortex, which is the advanced part of the brain. Your prefrontal cortex is what allows you guys to think in sophisticated manners and do math equations and philosophize and dream, and the prefrontal cortex is the advanced part of our brains that has really evolved human civilization. The amygdala, the hippocampus, and the thalamus, these are more primal components of your brain. They don't really do any advanced thinking. All they do is they regulate. They regulate your heart rate, your body temperature, your emotions, things of that nature. So anytime you get an incoming signal from your senses, it goes straight to your amygdala, and what your amygdala does is it visits its library, its fear library. Your fear library is your hippocampus. It stores all your fear memories, If you haven't exactly experienced that fear before, maybe you've seen it, it still stores it. So what your amygdala will do is you'll get a sensation. Let's say you feel something slimy. Well, you don't feel it. Your amygdala notices there's a slimy sensation on your hand. So it'll go into the library of the hippocampus, and it'll go to the slime section in your library, and it'll say, what do we have in here? Snails, lizards, yeah. Snakes, okay. Snakes, yeah, definitely, that fits. And what it'll do is once it's found a fear that matches the sensory data it's getting, it will initiate a fight or flight response automatically. So it'll release adrenaline and cortisol to help you run from that snake or fight that snake. Now, once the adrenaline response has been released, you get a secondary signal that comes up to the prefrontal cortex. So that secondary signal is a nerve where that adrenaline is running through. That signal of adrenaline hits your prefrontal cortex, and that's when you notice for the first time that you are anxious. So all of this happens beyond your conscious awareness. You only notice when you're anxious, when you're anxious. You're not involved in this process here. You're totally oblivious to it. And it happens so quickly. I can't even, mathematically explain how quickly it happens. But it happens so quickly that it's doing it multiple times. It's happening right now as you guys are sitting. If someone were to scream outside, you guys would hear that. Your amygdala would reference your hippocampus. Your hippocampus will send a fight or flight. It will go up to your prefrontal cortex, and by that time, you're already ready. And your mind is thinking, okay, what is it? What is it? What's going on? But your amygdala has already referenced that whatever's going on, you need to be ready for it. So this system is fully developed by 6 months of gestation. There's a lot of things that don't develop in children until later on in the gestational age. Our alarm system is fully developed by 6 months of gestation. So that highlights how important it is in the context of human development. So if the child were to be born prematurely, at least they'd have a startle response. They'd have some sort of security alarm to be able to let them know that danger is happening. So threats are detected by multiple senses. I talked about the 5 senses that we use or I didn't talk specifically about the 5 senses, but there are 5 main common senses that we know of. However, our amygdala uses much more than 5 senses to detect threat. So it uses sight, sound, touch, taste, smell, pressure, and itch. These ones, I'm not going to even go through them. I can pronounce them fluently. Thermoception, so how your body detects the changes in temperature. If there's an abnormal wave or an abnormal fluctuation in the temperature, that will elicit a fight or flight response based on if your hippocampus has a fear memory associated with that or fear reference associated with it. Perceiving gravity, pain, tension sensors. So if your muscle is experiencing a greater amount of tension on it than you normally feel in your day-to-day life, that could initiate a fight or flight response. Thirst, hunger, and magnoception. So that kind of has to do with the electromagnetic fields that we have around ourselves. So some people may not be as sensitive to that sense, but others are. So we're going to move into the prefrontal cortex and its job in regulating the fear response. So the prefrontal cortex is responsible for threat analysis and anxiety reduction or perpetuation. So it does this by an analysis in time and space, analysis of the future based on the past, empirical evaluation of analysis, and all clear signal or maintain current state of elevation signal relate to the amygdala. So this is where that manual comes in I was talking about. We need to have a manual of how our anxiety works and how to work with it properly. So your prefrontal cortex is concerned with cognitions. That's why cognitive behavioral therapy is very effective for anxiety, because you are addressing the part of your brain that has the power to reduce the anxiety response. So through training, we want to highlight your prefrontal cortex to analyze your environment empirically. So no what ifs. We want to get factual data. What's in your environment that you can prove that's dangerous? Not what you may think, not what might be there. What is actually there that we can prove? What's there that maybe if we can't prove it, let's reference our past. What has happened in our past in similar environments that this current environment kind of mimics? And is there the potential for danger? So we're doing kind of logical reasoning now. We're doing everything but assuming. So after empirically scanning the environment, your prefrontal cortex, through cognitive behavioral techniques such as coping thoughts, reassuring oneself that there's no danger, finding the evidence for and against danger, through repeating those coping thoughts to yourself, essentially you are sending the all clear signal to your amygdala to stop producing that fight or flight response, or at least to reduce it. Now, if you do find something in your environment, then you can send a message to keep it going, to even heighten it. So, holy cow, I am in danger. After you're empirically scanning your environment, you look over here and you see something that really is dangerous. And you relay that danger to your amygdala by telling yourself this is dangerous. So anxiety in adults versus anxiety in children. So in adults, it's an automated response to environments and or thoughts. In children, it's the same. In adults, the primary objective of anxiety is to predict and avoid death. Now, this is a hard one for people to kind of grasp. How does my social anxiety at work mean I'm going to die? Like, that makes no sense. We are a socially oriented culture. If you cannot fit within this socially oriented culture, you are essentially shunned. If you are shunned, then you don't have a lot of support mechanisms to help live your life. It's hard for you to live. So people with felonies, people who have been, what's the word I'm looking for? Their good name has been smeared. These people get depressed because they have a hard time functioning in society now. And essentially, if you can't function well in society, that's threatening to your life. So in children, the primary objective of anxiety is to move the child to caution when they feel vulnerable. Children have a lack of coping history. They don't have anything to reference how they can cope with the situation. What they do know is mommy or daddy can protect me, auntie and uncle can protect me. So when they're away from these safety figures and something threatening happens to them, they get a sense of caution because they're away from the person who can protect them from this threat. In adults, can primarily stem from cognitions and behaviors. In children, can primarily stem from a lack of secure adult attachments. So once again, that just highlights the fact that anxiety in children is based on feeling vulnerable in their environments without an adequate level of a secure attachment or protective figure. In adults, anxiety is an overestimation of danger and an underestimation of coping. Now this is when it gets into the maladaptive range where your anxiety now starts to control your life. You don't believe you can cope with the situation that happens, and you highly, highly overestimate that situation is going to be dangerous for you. In children, overestimation of danger, and they're mostly unaware of the concept of coping without training the child. And adults can use prefrontal cortex to reduce intensity of anxiety. In children, they are unable to use their prefrontal cortex to reduce anxiety. And this is primarily because the prefrontal cortex does not fully develop until the age of 25. The prefrontal cortex hits its first major growth spurt between the ages of 10 and 12, is when it hits its first major growth spurt. Up until that point, it's pretty much underdeveloped. So children have a hard time experiencing dual emotions. They usually can only experience one emotion at a time. So if they're angry, they're angry. If they're happy, they're happy. If they're afraid, but they can't be afraid and courageous. They need to be trained and coached how to do that. They can't say, I'm afraid of this, but I want to try it. That normally doesn't happen until they're about 10 or between 10 and 12 years old, where they can have two emotions at the same time. So anxiety disorders in children and in adolescents, common anxiety disorders in children ages 3 to 12, separation anxiety, selective mutism, specific phobias, and panic. In adolescent ages 13 to 25, and the reason that we take adolescent up to the age of 25 is because of the concept I was speaking to you about before. The prefrontal cortex is not fully developed until that age. So essentially they are still in adolescence in their early 20s. They're in the latest form of adolescence. So social anxiety, generalized anxiety, avoidant personality, obsessive compulsive, and panic. So we're not going to go through all of these in specific detail. You can find information about these just about anywhere, these disorders. But we are going to visit two of them. So avoidant personality disorder. And before I continue, I forgot to mention, if you guys have any questions, that's the best time to ask it. I like to answer questions when they're thought of, so don't feel in any way of asking a question and stopping the presentation. I would much rather answer your question if you have one than not answer it. So avoidant personality disorder, this is an important one because this one is often missed heavily. It's confused with social anxiety disorder. So it's characterized by marked avoidance of social activities due to extreme feelings of inadequacy and fear of negative evaluation and ridicule. These individuals feel inferior to others, so this is a key component that separates it from social anxiety. And APD grows from temperamental characteristics and or a lack of secure attachments within the child's life. So similar to social anxiety, but not quite in social anxiety, and primarily because individuals with avoidant personality disorder, they feel inferior in social situations and in interpersonal situations. It causes them anxiety in both settings. So that feeling of inferiority makes them hypersensitive to evaluations, judgments, and so forth. Now, someone with social anxiety does not necessarily feel inferior. They may be very confident in themselves. They just get extremely anxious or nervous in social situations. They don't like it. It makes them feel weird. Maybe they are hypervigilant of I guess, oh, what just happened? That wasn't good. Here we go. Don't hit that button. They may be hypervigilant of criticism, but that criticism doesn't necessarily manifest within them as inferiority. So they still have a sense of confidence within themselves. The next one is panic disorder. So this is seen primarily in adolescents. Kids do have panic attacks. It's harder to notice. But the onset for panic usually begins in adolescence. So fear of death from going crazy, acute panic attacks can occur with any anxiety disorder or independently and are commonly among adolescents. So they can have just straight panic where they've gotten really hyper aroused at one point in time, and they got so aroused to the point where their body started reacting in strange ways. They felt their heart skipping, they had a sense of derealization, they felt they were going crazy, and it was so distressing to them that they never ever want to feel that again. They never want to feel that sensation ever again. So they develop a phobia of becoming afraid, which is essentially what panic is. So the peak age of onset for panic disorder is 15 to 19. So like I mentioned before, a panic attack can stand alone, or a panic attack can be the byproduct of someone who has maybe a social phobia. That social situation is causing them to be elevated, to become hyper aroused and then panic. So they would be more afraid of the social situation than the panic. So children with anxiety disorders may present with fear or worry, but may neglect to recognize that their fears are unreasonable. Once again, that goes back to the prefrontal cortex. Younger kids often cannot articulate their feelings, and so we often see their physical symptoms first, if we know what we're looking for, that is. So those include things such as headaches, upset stomach, nausea, and we'll kind of get into these in the next slide. But a lot of physical sensations within kids can be linked to anxiety. Not necessarily, but it is highly probable. So what to look for? Physical complaints, insomnia, repeated visits to the parent's bedroom, changes in eating, avoidance of outside and interpersonal activities, excessive need for reassurance, inattention and poor school performance, and explosive outbursts. So physical symptoms continuing. Anxious children listen to their bodies a lot, so they're very in tune with how their bodies feel, and that alone can cause them to become hyper-aroused and hyper-anxious. Headaches and stomach aches, sickness in the morning, that's a very common one. So at our treatment center, usually I would say about 80% of the kids have some sort of stomach morning component with their anxiety. Their stomachs are upset in the morning when they wake up right away, or as they start to prepare for their day, their stomachs start to become upset. And they usually don't like to eat. A lot of school refusal has that component in it as well. Shortness of breath, chest pain, tachycardia, sensitive gag reflex, difficulty swallowing, dizziness, tension, derealization, and depersonalization, avoidance to the present physical symptoms. So there are some theories on the etiology of adolescent and childhood anxiety. So things such as temperament, their cognitive processing, genetics. So are they predisposed to be anxious biologically? Is mom anxious? Is dad anxious? Or are their brothers and sisters anxious? Neurochemical imbalances, learned behavioral response, attachment research, and psychoanalytic. So we're going to primarily focus on attachment research. That's what we use in terms of talking about the etiology of anxiety and also the treatment approaches. So common treatment approaches for anxiety: medication, behavioral therapy, cognitive behavioral therapy, exposure therapy, response prevention, family therapy, play therapy, mindfulness, eclectic approaches, and psychoanalytic therapy. So within the late adolescent population and the adult population, these two work primarily well. They actually work very well. Cognitive behavioral therapy these two. Cognitive behavioral therapy and exposure therapy, once the person has gone through the treatment approach, so this would be more of a standard treatment approach, so not deviating from the main tenets of it too much. Once the person has gone through those two therapies, they have an 80% chance of maintaining their gains, which is highly effective. Compared to, we don't have too much data comparing it to other therapies, but when compared to medication, once you stop taking medication, you're only likely to maintain those gains. You have a 50% chance of maintaining the gains that medication gave you. And that would be a direct correlation. So developmental psychology is making headways in the etiology of anxiety in school. So right now, many current etiologies focus on temperament and biology. So it's just a child's temperament, or they're biologically predisposed to be anxious. So developmental psychology focuses on attachment theory as a major cause of anxiety within children. So John Bowlby was the first to coin the term attachment theory in the late 60s and established the precedent that childhood development depended heavily upon a child's ability to form a strong relationship or with at least one primary caregiver. Generally speaking, this is one of the parents. So next we're going to get into modern attachment theory. So Bowlby's attachment theory focused on baby bonding. And modern attachment theory takes that beyond baby bonding throughout one's life. So attachment theory is a concept in developmental psychology that concerns the importance of attachment in regards to personal development. Specifically, it makes the claim that the ability for an individual to form an emotional and physical attachment to another person gives a sense of stability and security necessary to take risks and branch out, grow, and develop as a personality. The essential task for the first year of human life is the creation of a secure attachment bond to emotional communication, or a secure attachment bond of emotional communication between the infant and the primary caregiver. So the primary essential task for the first year of life is not to stay alive. The primary task is to form a bond with the caregiver. That is the primary task, because through the caregiver, staying alive is accomplished. So attachment is a lifelong process. We do not stop attaching ever, ever. I would dare anyone to try and stay single for more than 10 years. Probably go say, we need to be around people. Whether it's loose friendships, intimate relationships, we need to be around people for our sense of security in the world. Attachment can change. So if a child has an attachment to a parental figure, an event or something can happen to where that child is no longer attached to that parental figure now, even if they still live in the same home. So the attachment can change. So that's something I kind of monitor with my son. I always want to know, how is it? Am I losing my attachment? It waxes and wanes. So sometimes I feel I'm losing them. So I'll clear my schedule, and then it'll just be daddy son time. And we need to kind of shore up that attachment. A child can attach to more than one person at a time. So a child can have multiple attachment figures. They can have an infinite amount of attachment figures. There's no limit. Whoever's willing to establish a rapport with that child can be an attachment figure. And children can learn how to attach as early as preschool. So types of attachment, we have secure attachment, avoidant attachment, ambivalent, anxious attachment, and disorganized attachment. So this picture is a little dark here for those of you in the back. This is a picture of probably a toddler or a little older jumping off of a treehouse into his dad's arms. So an individual's feelings, so with the secure attachment, these are individuals' feelings that one or more caregivers are in tune with their needs, primarily emotional, on a consistent basis. So their emotional needs are always being met, if not always, at least consistently. So this doesn't mean they're always getting the latest, greatest toy. What this means is that emotionally, they're being cared for. Their emotions are being attended to consistently. Because of this consistency, the individual feels supported to take risks and explore the world. They have a home base of support to explore the world from now. Avoidant attachment, an individual's feelings that little or no caregivers are in tune with his or her needs on a consistent basis. So these children feel that no one gets them, no one cares about their emotions, or at least if no one cares about their emotions, if they don't have that concept, then they feel that their emotions are something they can't handle, and no one's coming in to help regulate those emotions, to help them see that they care. So because of this inconsistency, the individual does not feel supported to take risks and explore the world. So these children are avoidant. They're withdrawn. They may develop an inferiority complex. And this is where the avoidant personality disorder is kind of missed in childhood anxiety diagnosis. So in therapy, I use a diagnostic assessment that I created that assesses 14 different areas of anxiety. So pretty much any diagnosis in the DSM that has a component of anxiety, I test for it at the Anxiety Treatment Center. And in treatment, normally I'll pick up on the avoidant personality type in the session through analysis of the assessment, but I also see components of it during session. So avoidant kids respond a lot slower to exposure type techniques than kids who have social anxiety, and more so adolescents. So a kid who has social anxiety will respond a lot quicker to exposure therapy that is addressing their social anxiety than a kid who has avoidant personality. They'll respond a lot slower. And a kid with social anxiety over avoidant personality disorder, they may fully overcome their social anxiety. A kid with avoidant personality type, they will be very good at being in social situations or interpersonal relationships or interpersonal situations. But there'll still be that undertone of inferiority, probably throughout the rest of their lives. There'll be that undertone there. We won't be able to get them to the, desired outcomes as maybe someone who just has social anxiety. Ambivalent, anxious attachment. So an individual's feelings that one or more caregivers are both in tune and not in tune with their needs. So at one point they're crying and they're upset or they're anxious and the parent is fully there, they're invested in being with that child, and then the next day they're doing the same behavior and the parent is either frustrated by the behavior, they don't care about the behavior, things to that effect. So this creates uncertainty within children. Their environment now becomes uncertain. They're not sure how the adult figures in their lives are going to respond to them. So because of this inconsistency, the individual feels confused, insecure, and distrustful. So it's a lot of highs and lows. It's a lot of emotional disturbances. Disorganized attachment, an individual's feelings that one or more caregivers exhibits frightening behaviors to this person on a daily basis. So this can be classified as actual abuse, the frightening behavior, so physical abuse. It could be emotional abuse. It could be passive-aggressive abuse, so just being extremely inattentive and uncaring. Because of the consistency of frightening behaviors, the individual withdraws and detaches from their emotions and what's happening to them. So the consistent bombardment of frightening behaviors elicits emotional responses, and because they're so inundated with emotions, it becomes overwhelming for them. So they shut them off. They shut the emotions off and they detach from them.
I got a question.
Yeah.
So that one, if a parent goes through a hard time themselves in life and they're not as connected or attached, and then all of a sudden they're better, now that child's gone through that, and then can they get it back, I guess?
Mm-hmm.
Or did it affect them too much during that short period of time?
Well, what you said, the period of time is important. So we're always harming and helping our children. Every day we harm them, every day we help them. And unfortunately, that's the reality of parenting. We harm them and we help them. So as long as we could limit the harm and make the helping part more abundant, then to me, that's the best parenting we can do. So if you go through a hardship, the objective is to limit how long you're going through that hardship, because it will affect the level of attachment you have with your child. So it would primarily be about duration. So if the duration were long, then I would say yes, some damage probably did occur. But the brain is very adaptable, neuroplasticity. Once you get back to securing that attachment, you can recover it. To how much, I'm not sure. I guess it's a case-by-case basis. So emotion regulation is another component of secure attachments. So it's hard for children and teens to regulate their own emotions. It's hard for us as adults to regulate our emotions. So it's especially hard for them. Secure attachments show children how to feel their emotions through empathy and shift to regulating the emotion in an adaptive manner. So essentially what we're doing is we're giving them time and space to feel. They need to feel it. We don't want them to avoid it. We don't want to distract them from it. They just need to feel the behavior. And then over time, they will shift. And that shifting actually trains them how to regulate the emotion, because they have experience of cycling through the emotion and shifting from it. A lot of people who have, emotional issues or emotional disturbances have no coping techniques to deal with those emotions. So they have a hard time regulating the emotion. For a child, anxiety can almost be unbearable. Secure attachments help children to tolerate the anxiety, and it teaches them to learn how to feel it. So some components of effective emotion regulation. So whoever's providing the emotional regulation to an anxious child or an emotional child needs to be observant that the child is in emotional distress. So we need to become sensitive to how children appear in our environments. Calmly be in close physical presence with the child. Empathetically understand how the child is feeling. So you want to understand how they're feeling and not why they're feeling the way they feel. So, what made you feel this way? Was it did something scare you, or did someone say something to you, or they probably can point out what happened. They may not be able to point out what happened. But we don't want to put the responsibility on them to analyze why they're emotional. We just want to know maybe what was it, what caused it. Understanding from the child's perspective what caused them to become emotional. So like I mentioned, identifying maybe what the stimulus was that caused that. Empathizing with what caused the child to become emotional. So if we can identify the stimulus, maybe it was, someone said something rude, and we can say, yeah, it does hurt when people say rude things. That must have felt really bad for you. So we want to empathize with how the child is feeling. Letting the child know it's okay to feel his or her feelings. So giving them that space, you want to let them know that it's okay to feel the way you're feeling right now. There is nothing wrong with you feeling emotion. It is a necessary, speaking to you all, it's a necessary component of being a human being. Our feelings help us move us when we need to be moved. So, I never, ever, hardly ever give homeless people money when I'm just feeling normal. But when I feel empathy, I should probably cut my credit card up. So I'm giving a lot of money. I'm feeling that emotion. It pushes me to help.